So let's talk about the benefits or the potential benefits of palatal expansion. So is palatal expansion just about making space for teeth? The short answer to this is no, because in the right patient, expanding the upper jaw can have benefits that go beyond the simple alignment of the teeth. But it's important to be clear from the start. This is not a one-size-fits-all solution, and a proper diagnosis is essential. So let me explain. First, let's talk about the bite. A simple way to understand this is what I call the box and the lid concept. So the upper jaw is like the lid and the lower jaw is like the box. If the upper jaw is too narrow, then the lower jaw doesn't sit completely or comfortably underneath. So instead of closing in a stable position, it often shifts to one side or forward just to make the teeth meet. Over time, this can lead to crossbites, uneven contacts on the teeth, tooth wear, and strain on the TMJ or the jaw joints and the muscles. When we expand the upper jaw appropriately, the lower jaw can often settle into a more natural position that improves how forces are distributed across the teeth and can make the bite more functional and sometimes even more comfortable. Now let's move on to the breathing part. So the roof of the mouth is actually the floor of the nose. So when we widen the upper jaw, we are also increasing the space within the nasal cavity. In some patients, this can make it easier to breathe through the nose and to reduce mouth breathing and improve sleep quality. But this is a very important point. Breathing problems are multifactorial, and a narrow upper jaw may be part of the problem, but it is rarely the only cause. Things like enlarged adenoids, tonsils, or a deviated septum, or allergies often play a role. That is why a collaboration with an ENT specialist is so important. In children, poor breathing during sleep can affect more than just snoring. It can impact sleep quality, concentration, behavior, and in some cases, it presents as hyperactivity or ADHD-like symptoms. So if we address the underlying issue appropriately, whether there is an ENT treatment, expansion, or both, some children do show meaningful improvements. There are also links to some ear health. So children who mouth breathe often have issues with their Eustachian tube, which helps to drain the fluids from the middle ear. If this system is not functioning well, it can lead to ear infections or temporary hearing issues. Improving nasal breathing may help to restore a better function for the Eustachian tube, although again, this is not a guarantee and needs a proper assessment by an ENT. Finally, we can talk about the TMJ. There is some evidence in the literature to suggest that expanding a narrow upper arch may allow the lower jaw to sit in a more balanced position, which can reduce muscle strain or functional shifts in certain patients. But TMJ problems are also complex and multifactorial, and expansion is not a cure. It's simply one piece in the puzzle in selected cases. So what's the takeaway? Palatal expansion can improve bite stability, breathing, sleep, and overall oral health in the right patient, but it has to be done for the right reasons, with the right diagnosis, and often as part of a multidisciplinary approach. If you are considering this for yourself or your child, the first step is a proper assessment with a specialist orthodontist who understands both the benefits and the limitations of the treatment.